on dengue fever, which is on rise in Bangalore. In many of the places, I think whole of Bangalore, dengue is rising. And how to manage dengue in children. So as we know, dengue is a viral illness. It is caused by a virus and which is transmitted through mosquitoes. The mosquito is usually an Aedes aegypti mosquito, and this mosquito is usually a morning mosquito. Means usually it bites in the morning, and so this dengue can be transmitted from one person to another person through the virus. So first we should like to know like what are the key symptoms of dengue in children. So usually the dengue will show as fever, which can be mild in some cases, and it can be very high fever in some cases. But usually the dengue fever is high and it starts suddenly. The child will have fever for 3-4 days and then the fever starts subsiding down. The other symptoms can be of headache, usually is a frontal headache, and it can be accompanied by a lot of body ache, muscle aches. Sometimes the child may experience eye pain, which will be seen in complaint by mainly the bigger children may complain of eye pain. Then the child may have symptoms regarding the gut, which can be vomiting, nausea, stomach pain, or loose motions. Sometimes the child will have a lot of severe nausea and vomiting, and which has to be managed at home. The child may have fatigue, weakness, and this usually can be there when the fever comes down. After that, the child will start experiencing severe fatigue and weakness. Skin rashes. The skin rash may come in the child, which may be all over the body. And this rash usually appear after the fever has gone away and is usually a sign of recovery in the children. As the fever is there, a lot of nausea, vomiting, and the fever comes down, then the child may have severe weakness. At that time, the platelet or BP of the child may fall, and then it is followed by a rash. This is the typical symptoms in a mild type of dengue, in which there is not much low platelet count or there is not much BP fall, and the complications are not there. But how to treat this dengue at home? These cases of dengue can be easily treated at home and do not require hospitalization. Each case of dengue does not require hospitalization. If the child is having minor symptoms, it can be managed at home. So the child should be given paracetamol at appropriate doses at frequent intervals, and the tepid sponging, which is an essential part in dengue fever because the temperatures are rising so high that the child should be given sponging, because by the time you give paracetamol and the paracetamol goes inside the body of the child and acts, the fever may rise. That time the sponging of the child becomes very important to control the temperature. Because in children, high fever may sometimes give rise to fits. So the temperature has to be controlled with giving paracetamol and also by sponging the child. The child may be given anti-vomiting and anti-reflux medicines, which may be prescribed by the doctor to control the nausea and vomiting pain in children. And this also helps that the child takes adequate fluids and eats adequately. Otherwise may get dehydrated because of the high fever. Lot of fluids is the mainstay of treatment in dengue. The child should be given at least 1 to 3 liters of water per day, depending on the age and the weight of the child, so that there is no dehydration. Usually in dengue fever, there happens some fluid leaks in the body. This fluid leaks happens and this may cause dehydration in the children. And to prevent this dehydration or fall in the BP, the child should be given enough water. Rest is also important for children. The doctor may ask you to do a repeated CBC and platelet count. This CBC, platelet count and PCV is to monitor the platelet levels and hydration of the child. There is no role of any antibiotics in treatment of dengue fever. Now, when to admit the child and what are the danger symptoms which should be monitored in the child and should be taken immediately to the hospital. If there is persistent fever after day 5, the fever continues to rise, or during the fever there is severe abdominal pain and vomiting, severe vomiting, so that you are not able to give enough fluids to the child, there may be, it gives rise a suspicion that it may be having some complication and the child may require hospitalization. If there is any signs of bleeding, like gum bleeding or any bleeding from the nose, vomit, there is a blood, or then the motion, there is blood. So there are signs that the platelet may be low and the child may be require hospitalization. Severe lethargy in the child. Many patients come to me, the fever has gone away, the child, but the child is very, very lethargic. Usually these cases are of dengue and should be tested immediately because their platelet count may be low or there may be low sodium and dyselectronemia, which may require hospitalization. If the child is having rapid and fast breathing, it may require hospitalization. Or the child extremities are extremely cold, clammy, child is lying down. That means the BP of the child may be low and may require IV fluids in a hospital. So in such cases, you should take the child to the doctor and it may require hospitalization because we know that dengue can sometimes complicate into dengue hemorrhagic fever and dengue shock syndrome. So to prevent these complications of dengue, any early signs which I have discussed now, known as the danger signs, should be monitored and should be taken consultation immediately. So that's so I just see lots of questions. Some people can, anybody can ask any questions. Somebody is asking about a PPT. Yeah, we can send a PPT if you're interested. Just write your email ID. We can send you the PPT. But today's session is for more of a question and answer session. I just given a brief about dengue. And any questions, you can drop it in the chat or you can raise your hand and ask any questions. You can give your email ID so that I can give you the PPT regarding this presentation. So I just want to add here, like most of the cases when they come for the dengue and they're very scared for the dengue, they ask on the day 1 that should we go and test dengue. So first thing is on till day 3 of illness, usually the tests don't come positive. The dengue test may not come positive. So that time, please don't do the test day 1 of the fever. It may come negative and the fever, it may be still a dengue. They'll have to do a repeat test. Plus, in the dengue fever, usually the illness is for the fever is there for 4 days. That time, most of the complication doesn't happen. It's only the fever which may go high and there may be vomiting. So, control the fever and vomiting at home. Usually, the complication starts after the day 4 of illness. That is the time for testing the child for the platelet count and dengue. So should be done test at the early at day 3. So role of papaya juice in increasing the platelet count, most of the patients do feel it helps, but actually the role of papaya juice is not confirmatory. There is no confirmatory evidence that papaya juice will increase the platelet count. The platelet count in dengue is due to the suppression of our body's platelet producing mechanism. Not only the platelet, the WBC is also low, the neutrophil, the lymphocyte, everything becomes low because this dengue virus suppresses the bone marrow of the body for some time. The illness is self-limiting, so it suppresses and then slowly the body starts building up the platelet count. Papaya, as such, you can take papaya. Papaya is a good food which can decrease the gastritis, which may be accompanied by dengue. So, papaya, raw or ripe, both can be taken. But I would suggest not to give papaya leaf juice and all, because it may increase the vomiting in the child, which is already vomiting, and it may hamper the fluid intake by the child. So, as per me, you take papaya or raw papaya or ripe papaya, but not the leaf juice and all. Dengue fever is a viral illness, as I have discussed, and it is transmitted by the mosquito, and the mosquito is Aedes, Aedes, Aedes aegypti mosquito, and this mosquito is transmit this viral, and it's a day biting mosquito. Usually, this mosquito bites in the daytime. So please disinfect your workplaces or even the school. You have to see, because these are the premises where the child may get bitten by the mosquito, which must be carrying the virus. Fluid resuscitation. Initially the child should be given lot of fluids at home, and this can be electrol water, coconut water, even the lime water, sweet salty lime water is good enough. But the child should be taken at least 100 ml per kg weight of the child. That much fluid in a day should be given to the child to prevent the complication. If the child is dehydrated or not accepting feed, then there is a role of IV fluids. Caripler comes as a capsule, not for children. Adults can take it, but it's not for children. No, there is no fluid overload. There is fluid loss in the body, and it is makes fluid overload because platelet count decreases, fluid moves in third space, so causing ascites. I'm just reading this question. No, there is a fluid movement from the intravascular to the extravascular compartment, which may cause dehydration, less fluid in the intravascular compartment, and causing the BP low. Platelet is decreased not because of this fluid, it is because of the suppression of the bone marrow, because of the platelets are becoming low, and moreover the plates may get damaged also. Even the WBC is low and the PCV is also low. How effective is dengue vaccine and who should receive it? Dengue vaccine is got approved, but there is a limitation regarding the dengue vaccine, because first the child has to be tested whether he has ever had dengue or not. Because usually dengue illness first time is mostly self-limited, but dengue becomes more complicated if you get second and third time dengue. So if you have already had a dengue fever and if the vaccine is given, it may be okay. But if you have not had dengue fever and the vaccine is given, then for you, if you get dengue again, it may become a second time dengue. So first you have to get the dengue test done, whether you have got the dengue fever or not, depending on the criteria, then only the vaccine should be given. So dengue vaccine is still not approved because it may land up in making you a second cause of dengue. So still dengue vaccine is not approved in India. So regarding vaccine, many questions. So, but yeah, still dengue vaccine not approved in India because there are limitations for that vaccine. First, the dengue status with a particular type of test should be there, and that test is still not readily available here. So, dengue vaccine is still not approved in India. Who is most at risk of severe dengue and why? Uh, People with chronic illness and small children, if their platelet falls, then they are at risk. And old age people with comorbidities or any other illness is definitely at a risk of dengue fever. Dengue is transmitted through the mosquitoes. A person who is having dengue, if he is have bitten by a mosquito, the virus is there in mosquito's body and he can go and transmit to many other children. Dengue, yeah, during rainy season, the dengue cases are more because of the water collection in many parts of the city, which helps in breeding of mosquitoes. That is the main cause for dengue. So we should also do some measures to control dengue by removing any collections of water in and around your house. There's coconut shells or any pits where the water collection is stagnant. There will be mosquitoes breeding there, and which helps in spreading of dengue. Can we give oseltamivir to limit the infection process? No, I don't think so. Oseltamivir is a treatment for flu and not for dengue. How can I differentiate dengue symptoms from common illness? Uh, Mostly dengue is sudden onset of fever with headache, body ache, and vomiting. Uh, just with the clinical symptoms, we cannot be confirmatory on the diagnosis of dengue. It requires a blood test, which usually can be done on day 3 of illness.
There's a question in Q&A, ma'am.
Yeah. How can communities work together to reduce the risk of dengue outbreaks? Communities, especially we all repeat apartments, there should be the societies which should make a task force to see there is any collection of water clogging around their apartments or houses and remove all this collection. If there are certain ponds, there can be spraying for insecticide spraying can also help bring down the mosquito population. Water collection is absolutely necessary. There are certain gambusia fishes which can be put in ponds or any collection of water or water bodies. They usually eat the larva and control the mosquito population. There can be spray of oils also in water collection that also prevents the larva from hatching, and this all can help in the control of dengue. So, how can school and education interests play a role in dengue? Uh, School can educate the child. Nowadays, children are very receptive and they can educate the child, and child will definitely give this information at their home. And they can also send notice to the parents about the spread of dengue illness. And because if they are seeing many children falling sick, they can send notice to the parents, and the parents can then take action in their societies to control the mosquito population in that area. The recent advances in treatment or prevention, the vaccine was a recent advance, but it has a limitation and still uh, they're working on it to make it more better. Right now, this in dengue fever, there is transaminase increase. Yeah, there is a liver derangement, but I don't think we can be required to use zero uracil acid. We have to monitor it for some days. Usually, it takes 4 weeks. It will come down. If it doesn't come down, then we can think of treatment of liver function, some medicine for the liver function. What are the symptomatic? Does mosquito roll on work? Can we rely on them when we send them to school? Uh, Mosquito roll-ons do work to a certain extent, and I feel there are herbal mosquito repellents or roll-ons. They work, but for a limited period of time. I don't think it will suffice for the whole day of school. Full sleeves dresses and control of mosquito population in the school itself is more effective way of controlling this. What are the recent advances in prevention of dengue fever? What role do government health organizations play in controlling dengue fever? Uh, the government should really fill up the pits and garbage throwing around the cities. That has to be controlled with strict actions by the government and by penalizing the people who are throwing garbage around the roads, and which helps in collection. Usually, this plastics and all will help collection of lot of water and debris around the roads and proliferation of dengue. But apart from that, it is on us, the people. The people itself should be more vigilant and uh, do not throw garbage and other collection of waste around their home or around your apartment. Uh, that is where you have to find ways to dispose of the waste, find out bodies who can collect the waste from your house. How do technology and innovation control better dengue prevention? Technology, usually, I think it's mainly the knowledge which can be transmitted through the technology. Right now, I'm there to give you the knowledge of dengue, and you it should be given to all the people around, even from the uh, lower socioeconomic strata to the higher socioeconomic strata, because everybody should help in controlling the mosquito population around the cities, not only the government, but each and every individual, plus the government's effort should be there to control the mosquito population. How do you stay informed? How do you stay informed about dengue outbreaks? I think usually the doctors and all will tell you. We start getting a lot of cases of dengue, and they will tell. Plus, there will be newspaper this thing about the emerging dengue outbreaks. Control cytokine storm and dengue. How to investigate, treat these children. I think these are more medical topics regarding cytokine storm and dengue. Uh, you have to manage the cytokine storm in a hospital in a proper setup where with IV fluids, platelet infusion, um, uh, and other ways where we try to control the cytokine storm in dengue. How do you differentiate between dengue fever and other illness with similar symptoms? The dengue fever and COVID, which is more of a flu-like illness, dengue fever will not have much of cough and cold symptom, although mild throat pain and all can be there. But usually, and COVID and flu will have more of throat pain and severe chills with a lot of running nose. And dengue will have more of fever with vomiting, stomach pain. And as I told you, blood test has to be done to confirm dengue. And COVID can be, we can do a rapid PCR very easily at home nowadays to test for COVID. Even flu, we have a nasal swab technique where we can, the PCR test can detect flu, influenza type A, type B. There is a flu, adeno, flu, and COVID panel which is available in the labs now, in which they can test all the three flu, COVID, and adenoviruses, which can cause flu-like illness. So I think I've covered most of the question. Anything else? Um, any more questions? Anybody wants to know more about dengue? So basically, the thought for the day is many cases of dengue can be treated at home. That's what I want to emphasize on. And we should not panic on the sign that, okay, it's a dengue fever, because I've seen many cases who do not have fever also and having severe lethargy and all, and they are coming positive with dengue, and they can be usually managed by home. Even with a low platelet count, till 60,000, 50,000 platelet count, there's no panic if the child is not severely vomiting or having some bleeding manifestation. They can be managed at home, and the platelet will rise in on day 6 or day 7. Usually it starts appearing on day 7. The platelet starts reappearing. So it can be managed at home. Only fluids, paracetamol is the mainstay of treatment for dengue, and only the complicated cases should be treated at hospital. The first step when you take the patient suspected of dengue is rest, paracetamol, and fluids. You can give anti-vomiting or anti-reflux medicine because they do tend to have a lot of retching, vomiting sensation, nausea, plus you giving paracetamol at a frequent interval may also cause children to have nausea, vomiting, especially in children. They will have a lot of nausea and vomiting, and they don't like to feel. So test significance according to days, NS1. NS1 will be positive on usually on day 3 to 1 week of illness till the dengue is there. NS2 IgG is long term. It may persist for a year, or it may persist little more also. IgG. IgM comes down into the 3 months. IgG is a long term antibody. It may persist for a year. But NS1 is the one which we test, which gives an idea. It's positive in first 7 days of illness. There is no role of any steroids unless there are complication of dengue. Sure, you can send me your email ID. We'll send you the PPT. Miss SM Nadeem. Can you send your email ID so we can send you the this thing? But the video is available on our YouTube channel, Anexas Clinic, and you can watch it there. And I am a pediatrician in HSR now. Our website is www.anexasclinic.com, and you can have an online consultation also with me for any in future if anybody requires it. Naveen, can you post the website address and www.anexasclinic.com. So any query or online consultation is most welcome. So I think um, most of the queries were regarding the dengue and the platelet count. As I told, we can manage the platelet count. Normal platelet count of a body is between 1.5 to 3.5 lakhs. In dengue, usually platelet falls, but till 1 lakh, there is no problems. most of the cases there's no issue anything, but below 1 lakh we see about the bleeding manifestations. If there is any bleeding or severe vomiting, severe abdominal pain, then we are vigilant, and we may admit the child for observation. But below 50,000, definitely it has to be admitted with or without bleeding symptoms. So these are the criteria regarding platelet. But not only the platelet, the other criteria, severe vomiting and abdominal pain is also a impending sign that the child may have complication. So such children also we try to admit. So how does dengue fever affect pregnant women and what precautions should take? Pregnant women, again, the complication of low platelet count and the complications of dengue may damage the child. So the pregnant woman should take good precautions to prevent them from dengue. And should be, if any signs of vomiting or any high fever, should be admitted in hospital and taken proper uh, uh, treatment. The medicine for thrombocytopenia, actually the thrombocytopenia which happens due to dengue is transient and it will come back on its own, and most of the medicines do not work in thrombocytopenia. There is a thrombocytopenia which may affect with other viruses which can be long standing and which may cause severe thrombocytopenia. That time we give steroids sometimes, but there are certain anti-immunoglobulins also we give. That is a different kind of parvovirus kind of thrombocytopenia which may last for months together, and that time we have to treat it the bone marrow suppression. But in dengue, the thrombocytopenia is only transient. It remains for 4 to 5 days and comes back. So there is no treatment we recommend for thrombocytopenia. Dengue vaccine is not available in India. It is available in USA, and at present, because of the widespread dengue in our country, it is not recommended to take the dengue vaccine because it may make you prone to become a dengue severe illness. That's why the dengue vaccine is still not allowed in India. What is the pathology of dengue from entering virus till increase acute capillary permeability? So there is a virus which causes increase. There is a reaction in the body, which I think this more of a complicated discussion on this. How the permeability of the vessels are increasing because it is an autoimmune phenomena which happens and increases the permeability of the vessels. This is due to the virus interaction in the body with different autoantibodies and which may increase the permeability of the uh, uh, capillaries. So I think uh, any further questions are there. So, ma'am, how to conclusion the patient is recovering from dengue fever? The patient, usually the fever will go away on day 3, 4 or 5. After that, there will be a platelet low. Once, if there is a platelet low, you will see the platelet will start recovering, coming back. So if it is like it has come to 80,000 and next day it is 1 lakh, you can stop testing it. It started coming back and it will come back. That's a sign that this child is recovering. As I discussed earlier, a sign of rash can be sometimes, mostly the rash when it appears, we see the child may start recovering. So the parents are really worried about the rash and the itching, but usually it appears when the child starts recovering. So platelet if low, it shows, and if platelet is not low, the WBC will be low. and it will start showing upward trend. And once it shows upward trend, we cannot we no need to do the testing again because we know it will recover. And the mainstay of protection for dengue is the mosquito prevention of mosquito bites. You can use best is to use mosquito nets, put mesh all the windows, doors, no collection of water outside your house where the mosquito can grow. You can use this insecticide sprays and all. But one thing you remember that too much uses of all these insecticides can be harmful for your body, especially children. So I would advise not to keep this insecticides like all out and all constantly on in the room because they give rise to fumes and already allergies are rising the pediatric population. So I will suggest to use mesh in the windows, mosquito mesh, beds. And if you want to use an insecticide or all out, use it in a room, close the room for some time, then close the insecticide which is on, and then you can use it. Yes, dengue could cause wheezing for my child. Dengue itself doesn't cause wheezing, but if the child is having history of asthma and wheeze, any illness which may cause, because dengue also cause sometimes a mild coryza and throat pain, it may aggravate wheezing, but usually dengue as such doesn't cause wheezing. I think public awareness and all we should it's with the word of mouth, and it's what we are doing it here. I want to create more public awareness about dengue and how to prevent the dengue. And I think government and other things also should issue public notices about this, and our government bodies should also take care about um, collection of water and waste around the city. And I think your household helps should be properly taught about how to dispose of their waste and not collect water around their houses, which prevent, because any people, all the people should follow strict um, uh, strict guidelines for waste and other collection of water, which helps in the breeding of mosquitoes on a whole. So I think any more questions? Otherwise, we will. After dengue, my daughter's sleeping pattern changed. What can I do? I would like to know, like, how old is your daughter? 5 years. Okay. So how many days has been passed when she had dengue? 10 days. Okay. So still, she is just recovered from dengue. So just give her some time, and if she's not sleeping in the night or this, or if she's sleeping more, it is okay. You can give her some B complex tonic and all. She will slowly recover back. As I told you, dengue usually takes 2 weeks, so you just give her some more time. She will recover back, and see that she takes enough nutritious food, and with lot of she's waking up often at night. Okay. Does she complains of leg pain or something like that? No. Okay. You can give her some B complex syrup and see that she takes enough food, which may be the cause, or she may be having about some muscle aches and all. Or so you can give her a nice some massage in the legs and all. Usually dengue fever may cause little bit of muscle cramps and all in the night, so you can do that. Still 10 days only, it takes 2 to 3 weeks, she will settle down. B complex and multivitamins are good at this time. So fever with rash. We can have another session with fever with rash. Anybody else who wants to suggest some topics for a webinar, which we will be doing every month? Diarrhea, yeah, sure, we'll note it down. Pediatrics derma, okay. Pediatric dermatic conditions, sure. Selection of antibiotics, okay, sure. Antibiotics in pediatrics. Taslima. Taslima, from where are you? And Milind, Lucknow. Sure, Taslima, we'll do a session on antibiotics in pediatrics. Sure. ADHD in children. Newborn care. Sure. So I think Naveen, we've already got the topics, development and milestone, uh, sure, in newborn care, development milestone, diarrhea, ADHD children, and pediatric derma. Although I think I may not be a very competent enough for pediatric derma, but then other topics are fine. We can take through diarrhea and ADHD and growth and nutrition. We can antibiotics in pediatrics. Yeah, a good topic to take. So there's somebody cardio and neuro in pediatrics. Uh, so you can mail your queries on our email clinic@anexas.net. So I can take more. If anybody wants to know about any topic, you can send it a mail to this email. Importance of immunization schedule, and we will have a webinar monthly. Uh, so So thank you everyone. Thank you very much for attending today's webinar. And it is a immense pleasure for all of you to be here. And we will soon send you the webinar link for our next webinar, which we plan to do monthly once. And I'll keep a note on the topics which you have posted. Thank you. Thank you everyone for your time.